Welcome back to Style. Plenty of kids rely on their thumb as a self-soother. Say that a lot of times fast.
That was pretty impressive. Did your kids suck their thumb?
I had some of my children suck their thumbs. Luckily, they gave it up before they reached puberty. But
we're already working on Ella. I know it's only been a month, but no, we're just letting her do what she wants to do right now.
Yeah.
She's the queen. But plenty of parents worry about the long-term damage it can cause, or even that sucking their thumb makes their big kid look like a big baby.
Well, here's a story of one mom who took on her child's bad habit and won.
At age 3.5, Aiden knows his colors really well.
Orange.
And he has the sticker to prove it. Aiden has also been very good at sucking his thumb.
His speech started to get impaired from sucking his thumb.
Some call it nature's pacifier.
Right between the front two teeth. We call it nerve central.
The place where thumb sucking feels so good, so soothing. But it can really wreck a smile.
That gap is exactly where that thumb fits in and day out.
Dr. Jennifer Garza shows how thumb sucking pushed this child's permanent teeth up, causing an open bite. And this child developed a cross bite. Back teeth slipped inside, the front teeth outside the bite line.
So that lower jaw is permitted to grow off to the side.
And changing the shape of the child's face. And this is the classic overbite, teeth pulled forward.
A lot of these orthodontic bills can be eliminated or reduced.
It's why Aiden's mom took matters into her own hands. Well, Aiden's hands, really.
So I came up with this shirt that has the fabric coverage over the hands.
Called My Special Shirt. The generous fabric closed at the sleeves, not as tasty as a thumb.
It took him about a month, and now he can go to sleep without sucking his thumb and without wearing the shirt.
It's a simple concept, a blue shirt for boys, a pink shirt for girls, and some may be tempted to just try this on their own. But it's actually the program that makes the shirt work.
How to make it a positive instead of a punishment, and a rewards program kids understand.
Can you smile?
Aiden's teeth have started to move back, giving both mom and son something to smile about.
Well, for more information about the My Special Shirt or to order your own kit, go to the style page at WBIR.com and we will have a link to the website.
Why not, I guess. Give it a shot.
It's interesting.
It's interesting. Well, we wanted to get to the bottom of thumb sucking and what kind of problems it can lead to. Dr. Pablo Foncea joins us now from Sequoia Dental Arts in Knoxville. Now, we looked at some of the things that they showed there. Are those kind of extreme cases, or can thumb sucking lead to something that serious?
That was extreme. You can definitely see those cases, though here in Knoxville, it's not something that is uncommon. But the big difference was the severity and how long they were brushing. And if they are sucking their thumb, if they're sucking their thumb while their permanent teeth are starting to come in, that's when you really see a lot of major damage. And then it starts to become a lot more difficult to stop as well as correct.
So it's when the permanent teeth come. That's when you really need to start worrying about it.
With the baby teeth, most kids start to slow down or stop, or they see other kids that aren't doing it. And 2 to 4 years old is when they really need to start trimming back, I guess.
Let me write this stuff down.
And it does seem like a lot of kids just kind of naturally drop the habit.
And
just like at that same point, a lot of kids naturally drop the pacifier, if that's what they've chosen to use.
And that's exactly it. Most of the time that does happen, but I think parents do need to be aware that if it's becoming something of a very strong intensity, or if you can almost feel or hear the suction,
the pressure,
then that's really something that they are getting a lot of stimulation from, and you need to start positively, like the video said, positively encouraging them to praise them when they're not doing it, and that's really good.
How about a pacifier? Can that lead to those kind of problems, or
it
not as
can?
much?
But most people, it's rare to see an older child wearing a.
Or I'm thinking that 2 to 4 years. I guess you're not worried about it at that point.
Not so much. What's really interesting, and what they didn't show, is with like say a 3-year-old, and they're still sucking their thumb, and then they stop for whatever reason, or they put in an appliance. In some of these cases, you need to get an orthodontic appliance, put it in there, and it just is so uncomfortable for their thumb that they don't get any gratification out of it. With those cases, those teeth and jawbone will actually start to come back into place if it's been pulled out. And it can take 2 weeks to start noticing some difference, and then up to 6 months, and it's almost back to normal.
That's good. So you can put something in there to kind of help them out from that. So there's other things besides the paw things.
I guess if you're concerned, check with your dentist would be the bottom line.
And every dentist should know and have an idea of what to do and be able to evaluate what's going on.
Whew. Good. Yeah. I was worried a little bit.
Definitely.
I was thinking about those braces and everything.
Once you have a baby, everything becomes personal, doesn't it?
Yeah,
every subject.
All right.
Yours still needs teeth first.
Yes.
Then we can get to
When
it.
do those come? No, that's another discussion. Thanks so much for coming in, Dr.
Thanks, Dr.
Foncea.
Foncea.
Very well.
You could give him a call at Sequoia Dental Arts at 524-1265.
Now here's a new